like, well, we've heard from esteemed national and local speakers, but in a sense it's like, well, what are we going to do now? We know that whatever comes back from the government, there will still be a need for local action and to build on local practice. And that's kind of something about identifying what we have, seeing whether or not we can roll it out in a different way, or to make some changes. I really enjoyed, we've had a very gritty discussion this morning, and so often in these conferences, I think everyone seems to be trying to reach consensus. And I think we've heard some really good points of view here, because I think in a way we're not at that. But where we are at, I think, is basically is a common objective, which is improving the health of working age people. It's how we do that and what's included. I think that's more the dispute. What I have heard is agreement around the need for prevention and early intervention. I've heard something also about the need that whatever gets set up, whatever new services develop, we must be careful not to exacerbate inequalities. Because, as we know, people who are working in some of the more testing kind of industries are more likely to be suffering from ill health more than some of us office workers. I just need to declare an interest. I come from a public health background, and I really welcome occupational health as being started to be seen as a public health issue. It's not simply what happens in workplaces, it's actually something that affects everybody. So having said that, we want to hear from you now, really. We've got an opportunity over the next few months to present some proposals and some early thinking to the health partnership in this district and to the economic. It's going to be a joint meeting, and they are going to be interested in hearing the sorts of ideas that you might have for making some of the recommendations a reality. Again, as has been said, in terms of our priorities in Bradford, they have to be at focusing services that are available for the small and medium-sized businesses. More than 80% of our employers in this district only employ less than 10 people. So we're talking small employers, but we're also talking about the most disadvantaged employees. So I want you to perhaps to focus your thinking about how can we make a new fit-for-work service as something that will be properly accessible to that workforce, or those workforces, and to think about particularly the issues around mental health. Certainly we've heard from the local authority. I'm really interested in what they've been doing, some very practical kind of steps. But let's get some views from yourself. And what I'm going to do is I'm just going to basically note them down, because I want to use that as a basis for proposals.
I'd like to see a greater partnership between the local government and the primary care trust, whereby I think when Hilda talks about and Carol about a Corgi standard, a recognised quality standard of occupational health.
You just highlighted the point there about, I mean there is a tendency for a lot of GPs who don't really know how workplaces is to think that there are like duties. Most workplaces have now been stripped to the bone, and there are fewer workers doing the job. And it is important that they know that there aren't like duties, and it may actually be better for those people not to be back until they are 100% fit. But those are the issues that you need to actually get out. Yes, by talking, absolutely, I agree.
Yeah.
I agree.
But that could be covered by more occupational advisors in primary care. And, who don't necessarily need to be a doctor. You've got the doctors there on hand who can be advisors, who do understand the workplace, who do have a grasp of health and safety legislation and everything else that goes with that.
And presumably, there's training issues as well. There are. Training at all sorts of different levels, not necessarily to become qualified occupational health practitioners, so to understand what some of the issues are, to make them more effective in terms of their...
Although it's a medical initiative with the GPs, what we're trying to do is say, if you're just a GP but you don't want the diploma in occupational health, but you would like to know a bit more to be able to help your patient more effectively, we're trying to develop some web-based learning so that you're not trying to make them occupational health nurses or doctors, because it will be a waste of their expertise, but how do you get that extra bit of knowledge that then they feel more comfortable and they can then start this critical communication, because you know it's absolutely essential. So I think that there are ways of thinking about how do you do a little, bit by bit, to start this ball rolling.
We keep talking about what GPs do and don't know about the workplace and what occupational health advisors can advise them on, and there should be a greater dialogue. But as yet, nobody's mentioned asking the worker who's sick. And I think that as somebody who was once sent back to work when I wasn't fit, I had a note to say that I had to have my ankle raised above my hip at all times because I damaged it, my foot. That's not possible when you're sitting at a desk, but the doctor has signed me off well to go back to work.
Not everybody knows what the employee actually does.
Yes.
It's in relation to what they actually do at work.
Yeah.
And it's knowing about the workplace, not just that a person's fit or not fit, or whether we need
It's fit for what, isn't it?
It's fit for what.
Yeah.
So you've got to look at what their function is within there and whether they're capable of performing that function.
Yeah.
And what they need to help them perform that function.
Can I just add on to that? What we are in the process of trying to do is, right, when we're seeing patients that have seen a GP and are saying they've got fit to go back to work, they see us and we actually write a letter to the doctors to tell them what right duties we've specified to the employer.
Yeah, we keep the GP informed of what advice we've actually given to managers and their employees so that everybody knows and are seeing from the same input, more or less.
Do you see what you're doing currently as the basis for a Fit for Work service?
It's sort of it actually.
Yes, it is. Because in terms of
sort of it.
because in terms of next steps, it's like thinking, how can we make this service available to the smaller employers in the district?